are spherical. So they are double-stranded DNA, and it's a double-stranded linear DNA. Okay, so it's linear. Okay, and there are more than 35 proteins in the virion. So there are at least 35 proteins in the virions, and this DNA virus is usually has an envelope. So there is a nucleocapsid coating the DNA, and it contains several glycoprotein, and it's Fc. Okay, Fc receptor. So these Fc receptors are the one responsible for binding into our cells in our body. Okay, so the replication usually happens on the nucleus. Unlike your SARS-CoV-2, the replication usually happens in the cytoplasm. But here, because this is a DNA, particularly replication happens in the nucleus. While your SARS-CoV-2 is an RNA, the replication usually happens in the cytoplasm. So what are some outstanding characteristics of your herpes viruses? So number one, it encodes many enzymes. So there are many enzymes used by the herpes virus in order for them to replicate. So there are polymerases, there are kinases, and there are enzymes used for the transcription of your viruses. Next, your viruses usually establish a latent infection. So herpes virus establishes a latent infection. For example, your varicella, it establishes a latent infection on the dorsal root ganglion. It can be in the geniculate, pwede rin sa sacral ganglion. So when you recover from this infection, the virus becomes latent some part of the body. Some viruses become latent sa salivary gland, sa kidney, sa lymphocytes, sa spleen. So there are various organs wherein they lodge for latency. So meaning they do not replicate during this time, latency. So next, they persist indefinitely in infected hosts. So once you still have the lesion, for example, you have the chickenpox, you still have the lesion, even if the lesion is already drying, okay, you are still considered as infectious. You still have the virus, okay? So the virus is shed off actively when you are already recovering. So you are no longer infectious, okay? But sometimes you may also be infectious. You may be still infectious if the lesions are still visible. So frequently reactivated, immunosuppressed. So these herpes viruses are usually, remember, they become latent and they become reactivated once you become immunosuppressed. Okay, once your immune system usually goes down. And some can cause cancer. An example of this is your Epstein-Barr virus. Okay, so this is a gamma virus that can also cause cancer. Later on, we will discuss one by one. So next. Okay, so this is the structure of your herpes virus. So it's a double-stranded, you see. This is a double-stranded linear DNA, and it has its capsule. Okay, it has its nucleocapsid capsule coating, okay, protecting the DNA, and it's the eco. So this is an icosahedral symmetry. Okay, there is a particular here envelope. Okay, so this is the envelope. Okay, so coating also the herpes virus, and there is what we call the tegument. Okay, so this tegument contains at least 35 polypeptide proteins. So these are the colored ones. These are the teguments. Okay, these are the tegument. The one, the orange, the yellow, the violet, these are tegument. These are polypeptide protein, and the tegument is located between the envelope here, between the envelope and the capsule. Okay, and the capsule. Okay, so this area is the area of the tegument. Okay, so next, the herpes virus genome is a large. Okay, this is a large. Okay, this is a large family, and it encodes at least 100 different proteins. Of these, there are 35. Okay, there are 35 polypeptide, which are involved in the structure. Okay, in the structure of the virus particle. So at least 10 are parts of the viral. Okay, at least 10 are parts of the viral envelope. Okay, so your herpes virus encode an array of several enzymes, okay, responsible for the gene expression, DNA synthesis, and protein regulation. So what are these several enzymes responsible for the DNA synthesis, gene expression, protein regulation? So these are involved in the nucleic acid metabolism. And these are the enzymes. We have the DNA polymerase. So we have the helicase primase. We have the thymidine kinase. We have the protein kinase and the transcription factor. So you have several enzymes involved in the gene expression of your herpes virus. So all of these are necessary for your DNA synthesis. Okay, for them, for this herpes virus to replicate. So all of these are necessary, and all of these enzymes can be inhibited. Okay, can be inhibited by your antiviral drugs. Okay, so enzymes. This is very important table of Jawet's. So this is the classification of the human herpes. Okay, so your classification of human herpes, according to biologic properties, they are subdivided into three subfamily. The first one is your alpha herpes viridae. Your alpha herpes viridae are short. It has a short growth cycle. So meaning it can replicate very, very fast. So it's a fast growing. Okay, it's a fast growing and it can cause cytopathic effect on the tissue. So it can destroy, it leads to cytolytic. Lytic is destruction, so it can destroy the cell. So cytolytic is cytolytic. And this alpha virus, okay, viruses can become latent. So they become latent on the neuron. Okay, neuron. So what are examples of this alpha herpes virus? So we have HSV1 and HSV2. Okay, so later on we will discuss what are the one and what are these two. And we have the herpes virus 3, other known as your varicella zoster virus. Or in layman's term, this is what we call your chickenpox. Okay, bulutong tubig. That is your 3. Okay, next we have the beta subfamily. So we have the beta herpes viruses. They are long. So meaning long, they are slow growing. Okay? And maybe, they may be cytomegalic. Okay? So when they infect the tissue, usually they become large. Okay? So they have a large nucleus. Okay, cyto. Mega means large. Okay? Cyto is cell. So large. Okay? They become large. So when they become infect the cell, they become large. So cytomegalic. So they become latent, sa glands, salivary gland, sa glands, like your salivary glands, kidneys, and lymphoid tissues. Examples of these beta are your cytomegalo, and this is your herpes virus 5. Your herpes 6 are your human herpes virus 6, and your 7 are your human herpes virus 7. So these are all your beta herpes viruses. And lastly is we have the gamma herpes viruses. So they are variable. So meaning variable, they can be short and they can be long. Okay, they can be long. So these are exemplified by your herpes virus 4. Okay, and this is otherwise known as your Epstein-Barr virus. So later on, we will discuss this one by one. And your herpes virus 8 is otherwise known as your Kaposi sarcoma. So all of these become latent in the lymphocytes, in the lymphoid tissue. So all of these are your subfamily. They're like SARS-CoV-2. Your SARS-CoV-2 has also alpha viruses, beta coronaviruses, and gamma viruses. So all of these are your families of your herpes. So 1, 2, 3, 5, 6, 7, 4, and 8. And there are specific names here. So let's go to their viral replication. So how do they replicate? Okay. So this is the herpes viruses. So herpes viruses usually can be transmitted through droplet, through droplet inhalation, and can be also be skin to skin, For example, you have a non-intact skin and your partner also has a lesion, a lesion, for example, and it can be transmitted through skin to skin contact. So once the virus enters in our body, it attaches into the plasma membrane. It attaches into the plasma membrane. So the virus fuses with the plasma membrane and the viral DNA is released from the capsid. So this is the viral DNA released from the nucleocapsid. and it enters here. This is the cytoplasm, this is the nucleus, and the DNA enters into the nuclear pore. Okay, nuclear pore, then this is followed by circularization. Okay, circularization of the DNA. Okay, and this genome, okay, undergo transcription. Okay, undergo transcription. And the product of transcription is known as your immediate early genes. Okay, immediate early genes. Next, go to step 2. Okay, step 2 is we have the alpha. Okay, we have the alpha protein. The alpha protein are the product of your immediate early. Okay, so the alpha proteins are the product of your early genes. Okay, which stimulate the transcription of your early genes. Okay, so the product of your immediate, okay, early genes are your alpha proteins, and your alpha protein, okay, alpha protein stimulate the transcription of your early genes. Okay, anyway, this is also in Java. Next, step 3. You have the step 3 here. The step 3 is you have the beta proteins. The beta proteins are the products of your early genes. Okay? So, ang product ng immediate early genes are the alpha proteins. The product of the early proteins are the beta proteins. So, the beta proteins are the product of early genes, and these beta proteins are responsible for the DNA. Function is in DNA replication. Okay? DNA replication, and once it replicates, it yields what we call your concatenameric DNA. Okay? It yields what we call your concatenameric DNA. Okay? And after this step, late genes are transcribed. This one. Okay? So the late genes are then transcribed. Okay? So the fourth step here, the fourth step is the production of your gamma proteins. So gamma proteins are the product of your late, okay, the product of late genes. Okay, and these gamma proteins are the ones that contains, okay, are the ones that contain the viral, this one, okay, the viral DNA. Okay, so these are the viral, okay, the viral DNA. So they will be the concatenameric, this one, the concatenameric genes will be clipped off, they will be cut off, okay, and forming what we call your viral DNA. Okay, so your viral DNA is packaged into capsid. Yeah, so they will be packaged into capsid. Yeah, capsid is one. Okay, they will be packaged into capsid, and they enter into the endoplasmic reticulum. So this is your rough endoplasmic reticulum. So they accumulate in the rough endoplasmic reticulum. From the rough endoplasmic reticulum, they are packed into the Golgi apparatus. From the Golgi apparatus, they get out of the cell, this one. They get out of the cell, and once they get out of the cell, they get the membrane of the host cell membrane, this one. And the membrane of the host cell, okay, will become their plasma membrane. Okay, so the plasma membrane of this virus comes from our host, come from our body when we are infected. And this virus will be shed off to infect another cell. So there will be cell-to-cell spread. Okay, so idadamay niya yung katabi, yung kadamay niya, yung katabi niya, cell-to-cell spread. Okay, but of course, if we produce interferon, the adjacent cell will be protected. Okay, so this is how your viral transcription, viral replication happens. Okay, so next. Okay, so what are the effects of virus in our host cell? So when will this herpes virus cause disease, or what are the effects? So when it enters into the cell. So when it enters into the cell, this viral infection causes what we call your cytopathic effect, or CPE. Okay, so your cytolytic effect. So what are these cells, virus that can destroy our tissues? So we have the herpes viruses, we have the varicella viruses. And some of these herpes can lead to malignancy, malignant transformation. An example of this is your Epstein-Barr viruses, under your herpes viruses. And some of these viruses, okay, if left untreated, may lead to complications, and the worst, it may lead to demise or death. Next. So these are some effects on the tissue. Okay, the cytopathic effect on the tissue. So we have the herpes simplex, okay, so causing a swollen, rounded cell. We have the varicella zoster, causing your giant cell containing acidophilic intranuclear inclusion. This one, the giant cells, once they become infected, okay, so these cells become giant or multinucleated giant cells. So there are a lot of nucleus become large. Okay, we have also the cytomegalovirus infecting the human fibroblasts. Okay, so later on, this will also be discussed in your pathology. Okay, so let's go to the overview of your herpes viruses diseases. Okay, so we have the herpes virus. So the herpes virus usually infect the epithelial cells, so the lining cell, the epithelial cells. Once they get into the epithelial cells, okay, they replicate inside the epithelial cells. So remember, where the point of entry, they replicate there. So replication happens at the point of entry. Now we have the herpes virus 1, herpes simplex virus that can cause your fever blister. Okay? So one point in time, baka nagkaroon na kayo ng mga fever blister at the angle of the mouth or surrounding the mouth. And this is what we call your oropharyngeal lesions, known as your fever blister or otherwise known as your cold sores. Okay? And your Hsv1, okay, is commonly causing this fever blister, and it can cause sporadic encephalitis. Okay, it can cause sporadic encephalitis. So this is the leading cause of your viral encephalitis. While the other one is your herpes simplex virus type 2. Okay, herpes simplex virus type 2 primarily infect the genital mucosa. Okay, so primarily infect the genital mucosa. So you can see here in the genital area, there are vesicle, okay, vesicle. But your fever, but your Hsv2, okay, these viruses also cause neurologic diseases. But more common is your Hsv1. This is still the leading cause of your viral encephalitis. Okay, next. So we have 1 and 2. Your 1 is the fever blister. Your 2 is causing the genital lesion commonly. Okay, and your varicella zoster. Okay, so this is your herpes virus 3. Okay, otherwise known as your varicella zoster or your chickenpox. Okay, so primarily infect and establish a latent infection. So for example, this child, he had a varicella zoster, he had a chickenpox, okay, and after recovery, the virus becomes latent in the dorsal root ganglion, okay, and this virus becomes reactivated during childhood when she becomes, for example, diabetic, uncontrolled in sugar, it becomes reactivated, okay, and it can cause herpes zoster, okay, herpes zoster. So reactivation of your varicella is known as your herpes zoster. Remember, if you had varicella, you can no longer have chickenpox anymore, but they can become reactivated, and reactivation is known as your herpes zoster, or otherwise known as shingles. So they become reactivated, yeah. Okay, the virus, okay, pass from the cell body to the axon, and from the axon going to the skin, causing your shingles. And this may also lead to complication like viral pneumonia. Okay, so what about your cytomegalovirus 5? Okay, your CMV or otherwise known your herpes virus 5. So this herpes virus, cytomegalo, replicates in the respiratory tract, so it can cause pneumonia. It can also replicate in the salivary glands and kidneys and persist. So they persist in the lymphocytes. So they become latent in the lymphocytes, the lymphoid tissue. Okay, so this cytomegalovirus can cause the disease known as your infectious mononucleosis. Okay, infectious mononucleosis, and it can lead to, and there is heterophil negative. So there is no heterophil antibodies seen here. Unlike your Epstein-Barr, may makikita kang heterophil. Okay, later on we will discuss what are these heterophil. So this is an example of your cytomegalovirus cell, infected cell. Okay. So you have a cytomega, means large. So you have, compared it to the other cells that are not infected, they become large, megalo. Okay, they become large and they have two nuclei, multinucleated giant nucleus. Okay, the chromatins are pushed to the periphery because of the enlargement here, and it looks like an owl's eye. Okay, an owl's eye. So this is more typical of your cytomegalovirus. Okay, your cytomegalovirus usually infect, okay, particularly your pregnant, okay, pregnant mothers. Okay, the pregnant mother has cytomegalovirus infection and it can be transmitted through placental circulation. Okay, and pwedeng makuha ng fetus and it can lead to mental retardation and permanent deafness. So there will be effects. Okay, so mental retardation and deafness. The cytomegalovirus. Remember in the previous lecture, it can lead to congenital defect, microcephaly. Okay, next you have your HHV6. It infects the T lymphocyte. So this is the T lymphocyte. So you see here the viruses on inside the lymphocytes. So it's typically acquired. Your 6 is typically acquired early infancy. So this is typical rashes of your HHV. Para siyang measles. Okay. So herpes, otherwise known as your exanthem subitum or your Yoshiola infantum. So this came out in the board exam. So tinanong lang what virus is your causing your Yoshiola infantum. Okay, and that is your human herpes virus 6. I think this was asked in Penja. Okay, what about your Epstein-Barr virus? Okay, your herpes virus 4, herpes virus 4. So otherwise known as your EBV, and your EBV is otherwise known as your kissing disease. Yeah, kissing disease. For example, this is a man with Epstein-Barr virus. Okay, on his salivary. Okay, he kisses her wife. Okay, and he transferred the EBV via the saliva going into his wife. So it replicates in the epithelial cells of the oropharynx. It replicates on the parotid gland and establish latency on the B lymphocytes. Okay, on the B lymphocyte, causing what otherwise known as your infectious mononucleosis. Remember, your cytomegalovirus is causing also infectious mononucleosis. Your infectious mononucleosis, parang fever, headache, body malaise, these are some of your non-specific viral infections. Okay, so but this one, infectious mononucleosis, is heterophil positive. So later on, we will discuss when we move on to your Epstein-Barr virus in detail. So we will discuss this later. Okay, so what about your HHV8? Okay, your HHV8 is your human herpes virus 8 and it appear to be associated with Kaposi sarcoma. So these are lesions of your Kaposi sarcoma. It looks like a grayish lesions. It's elevated on the skin. So this is common among patients with HIV. Okay, so this is CA of the skin, otherwise known as Kaposi sarcoma, and commonly infects those with HIV. Okay, HIV virus, AIDS patient. So that's HHV/AIDS, Kaposi sarcoma. Okay, so if you have the human herpes viruses, okay, the herpes viruses, okay, they become reactivated. So when will they become reactivated? If you become immunocompromised. For example, this is a cancer patient undergoing chemotherapy. Okay, so patient, once they become reactivated, it leads to what we call your severe disease. So the severity of disease usually happens among immunocompromised patients. But if you are immunocompetent, you may recover usually. Next, your herpes virus infection in humans. Now let's go to your Hsv1, your herpes simplex virus 1. As I've said, your Hsv1 is commonly causing your fever blister. Okay? So parang sabi mo, ay, parang may singaw ako. Okay? So parang yan is fever blister or cold sore, singaw. Okay? So it can happen at the angle of the mouth. It can happen in the gingiva, okay, causing gingivitis. It can spread into the cornea. Okay, later on we will discuss what happened when it affects the cornea. And your HSV2 is the one commonly causing your genital herpes. And both of these, 1 and 2, can cause encephalitis, but more commonly 1, causing your sporadic encephalitis, so infect the whole part of the brain. Okay, encephalitis, so inflammation of the brain. So the characteristic histopathologic findings include So one, there is ballooning of the infected cells. So this one is the infected cell. You see ballooning, become large. Okay, ballooning of the infected cells. They develop a COVID type A, eosinophilic internuclear inclusion bodies. Okay, and because of the enlarging, the chromatin are pushed on the site. So there will be margination of the chromatin and formation of your multinucleated. You see this one? Multinucleated giant cells, and it can spread to the adjacent cell. Okay, cell fusion, cell to cell spread. Okay, so this is the pathologic findings of patient with herpes viral infection. Okay, so how do the pathogenesis happens? So we discuss again. For example, you have a friend. So last 2 weeks or last 2 months or 1 month, I have a patient with vesicular lesion on the scrotum. Ang dami niya. Okay, when I ask him, did he have a sexual contact? And he admitted that he had a sexual, okay, he had admitted that had a sexual contact. Okay, and 1 week after, or five to 7 days after, he notices a vesicle on the scrotum, multiple vesicles on the scrotum. Okay, so this is a sexual contact, Hsv2. Okay, so this is the entry point. So it enters into the skin of the scrotum. So there will be replication of the virus. So makikita ka maraming vesicular lesions here. Okay, so once they do replication at the entry site, they go into the nerve. Okay, they go into the nerve. Okay, they penetrate the nerve. Okay, so once they penetrate the nerve, it travels to the axon. It travels to the axon going into the cell body. Okay, if it's a genital herpes, it usually goes into the sacral ganglion. Okay, so gumaling na siya after healing. Okay, the virus becomes latent on the sacral ganglion. Okay, into the cell body. Okay, and then after some time, when he becomes immunosuppressed, remember nasa latent infection siya, so the virus does not replicate. For example, okay, after 3 months or 4 months, after 1 year, become immunosuppressed, these viruses in the sacral ganglion may become reactivated, and it may travel from the cell body to the axon. Okay, from the cell body, okay, to the axon, and it goes again into the skin. So there will be recurrence. So infection may produce vesicular lesion which contain fluid and infectious virus. So it is recurrent, even though if you develop antibodies against this herpes simplex, but once you become immunosuppressed, it becomes reactivated. Same through with varicella, it becomes reactivated as zoster. So pag nagkaroon ka ng zoster, pwede uling bumalik na magkaroon ka ng zoster. Okay, once you become immunosuppressed. Unlike your varicella, you have antibodies na doon, but the reactivation become recurrence. Okay, so these are the differentiating point between 1 and 2, herpes simplex 1 and herpes simplex 2. You see your 1? Okay, sandali lang, meron na akong call. Hello? Yes, ma'am. Opo. Repeat CT scan. Carry out. Nag-usap na rin kami yung anak niya na mare-repeat CT scan siya. Okay, carry out po. Thank you po. Okay, so your Hsv1, remember, it's a fever blister. Once you recover from the fever blister, the virus become latent where in the trigeminal ganglia. It becomes latent in the trigeminal ganglia. For example, you have fever blisters on the genital. It becomes latent in the sacral ganglia. So your Hsv1 usually happens among young children. Okay, and this is usually contact often in the saliva. And young adults usually Hsv2 because they are sexually active. So these are the signs and symptoms differentiating your 1 and 2. So kindly go over with this slide. Okay, so this is in summary of your pathogenesis of your herpes simplex virus. It enters the sensory nerve terminal at the peripheral side. Okay, it goes into what we call retrograde transport from the axon to the cell body. So it enters the trigeminal ganglion. Okay, it then stays here for latency, and once it becomes reactivated, okay, it travels from the cell body to the axon, so the dorsal root ganglion along the sensory nerve, and it goes into the skin again. okay, and result in recurrent. You see this one, recurrent infection. Okay, so reactivation is usually recurrent. So recurrences are usually asymptomatic. Okay, and if it's symptomatic, usually mayroong cold sores, HSV1, and 80% harbor HSV1 in their latent form. So majority of us who become infected can harbor this, okay, latent infection, 80%. Okay, particularly dun sa HSV1. Mas mataas yung latency. Okay, so the clinical finding, primary infection occurs in person without antibody. Yung primary without antibody. Okay, most individuals are clinically inapparent but results in antibody production. So no signs and symptoms, but we may still develop antibodies. Okay, and they establish latent infection in the sensory ganglia. Okay, so geniculate or the trigeminal ganglion or in the sacral ganglion. So this is where they become latent, her HSV. So your fever blister usually happens or common among 1 to 5 years old. 1 to 5 years old. Your symptoms can be gingivitis, the gingivitis, and this is the most common lesion of your HSV1. So the incubation period of HSV1 is usually 3 to 5 days, and clinical illness lasts 2 to 3 weeks. So makikita mo may fever blister, matagal at least 2 weeks, 14 days. Pag medyo matagal pa, at least 21 days. Okay? So usually that happens, and reactivation may also happen during adulthood. Okay, so the primary infections, okay, in adult is pharyngitis and tonsillitis kapag na-reactivate sa adult. So there will be localized lymphadenopathy. So magkakaroon ka ng mga kulani dito. Localized lymphadenopathy, and this is recurrent clusters of vesicles at the borders of the lip. It usually, if it happens in immunocompromised, okay, usually it has many lesions. Okay, many lesions. If it's left untreated, it may also lead to secondary bacterial infection. So makikita mo mayroong mga nana na rin. Instead of viral, okay, it may also lead to secondary bacterial infection to the point that he needs already antibiotics. Okay, so your HSV1, okay, can also lead to keratoconjunctivitis. Okay, yung keratoconjunctivitis. It may also affect the cornea, the corneal ulcer, and if this is left untreated, it may involve the whole cornea and may lead to corneal opacification. Corneal opacification. Sometimes it may also lead to, okay, vesicles dito sa eyes. Okay, so this is the genital, your HSV2, causing your vesiculo. You see, these are the vesiculo-ulcerative lesion of the penis. This is a sexual contact. Among female, you have your vesiculo-ulcerative lesion on the cervix. You can see also on the vagina and also on the perineum. So this is your HSV2. Okay, so this your HSV2 can also lead to HSV1, especially if there is an oral sex that happens. Okay, oral contact. Okay, and your HSV2 can lead to, okay, HSV1 as well. Okay, so these are some of the skin infection. If the skin is intact, you become resistant. So walang papasukan yung virus. But if you have lesions, okay, for example, this is a wrestler with herpes simplex, okay, and this has also a lesion, so it can also be skin-to-skin contact. And this is otherwise known as your herpes gladiatorum. Okay, we have also herpetic whitlow. So you have the Herpes virus here. So these are common among dentists, herpetic whitlow. And if you have eczema, okay, it can also lead to eczema herpeticum. Okay, eczema herpeticum. Okay. So as I've said, what is the complication of this HSV1 and HSV2? So the most common complication is your encephalitis, particularly your HSV1. Okay, and I have a patient with viral encephalitis, and after he recovered from viral encephalitis, he had neurologic deficit. So nag-isip bata siya. Okay, from a 13-year-old, parang age siya naging 6 years old. He had a neurologic deficit. And this has also a high mortality if left untreated. So 25% of patients with herpes encephalitis may also suffer. He also die. Mataas yung kanyang mortality rate, 25%. Okay? So what if happens if a mother has genital herpes and she delivers her baby via vaginal delivery? Okay, so this newborn may acquire, okay, the herpes virus during birth or after birth. So this baby is immunosuppressed because he does not have a lot of antibody yet. Okay, so it may unable to limit the spread. Okay, unable to limit the spread and propensity to develop a severe disease. Okay, 75% caused by Hsv2. Yan, may lesions ng bata, meron din dyan. Okay, and always symptomatic. Okay, and if this left untreated, 50% may die. Okay, so there is a very, very high mortality with this virus. Is encephalitis. So lesions can be localized in the skin and mouth. Encephalitis may happen, and it can may disseminate involving the multi-organ, including the central nervous system. Okay, so other complications, we have viral pneumonia, and it may also lead to intravascular coagulations, aside from encephalitis. Okay, so these are other complications of your HSV. Okay, so again, who are infected, patients who are malnourished, patients who have AIDS, okay, who becomes reactivated, and patients with hematologic malignancies. Yung may mga cancer sa blood, okay, like leukemia. So immunity, okay, so antibodies are lost during the first 6 months of life sa mga baby, and they become susceptible 6 months to 2 years. So they may appear in early childhood by adolescent, present in most cases. So early childhood. And Hsv2 rise during adolescent because they are usually sexually active. And the first antibody na tataas is usually the IgM, then followed by your IgG and IgA. This is IgG and IgA. Okay, so how do we test? Okay, so we test by means of your PCR, polymerase chain reaction. So we amplify the DNA of the herpes virus. Okay, and the definitive diagnostic test, you get lesions from the skin and you do a viral culture, isolation and identification. But it's not done. Okay, what is commonly done for viral diagnostic test is usually your PCR. Like your SARS-CoV-2, you have the RT-PCR. Okay, so we get the skin, we scrape the base of the skin, okay, and we do staining, and you can see multinucleated giant cells. Yung kanina pinakita ko, yung pathology of the infected cell, okay? And serology is antibody appear 47 days after the infection and peak at 2 to 4 weeks. Okay, so these are the epidemiology of your Hsv1 and Hsv2. You see, 1 are common oral, 2 common genital infections. Okay, so how do we treat? Okay, treatment, prevention, and control. So the treatment for your herpes is your acyclovir. Okay, so what are the preparations of acyclovir? It can come into valacyclovir or famacyclovir. So these are the prodrug. Your prodrug has to be activated into from val to acyclovir, from famacyclovir to pencyclovir. This acyclovir, pencyclovir will be activated by your viral thymidine kinase. From acyclovir, okay, it is converted to monophosphate. This monophosphate will be activated by cellular kinase to become acyclovir triphosphate. So this is the active form of the acyclovir. It's the triphosphate. And the triphosphate will inhibit the DNA polymerase. It's the triphosphate, not the monophosphate, that inhibit the DNA polymerase. Once you inhibit the DNA polymerase, the virus can no longer replicate. Okay? So that's your Hsv1 and Hsv2. Let's move on to your varicella zoster, your chickenpox. So your chickenpox is usually highly contagious, okay, in children. So that's why if a child has a chickenpox and you live in the same house and you did not have any chickenpox, okay, during your childhood, then you have to isolate this child. Kasi if you had a chickenpox during the adulthood, it leads to many complications. Pero pag child na nagkaroon, he may recover. Okay, so these are the generalized vesicular lesions, okay, of the chickenpox. So once you recover this, okay, and during adulthood, it becomes reactivated, you become immunosuppressed, and the reactivation is known as your zosters or shingles. Madaling i-diagnose. Kasi pag zoster or shingle, makikita mo yan, may line dito. It usually does not cross on the other side. Okay, it's usually unilateral. If it's in the trunk, it's unilateral. It does not cross over. Okay, so there is a dermatomal distribution. So this is typical of your herpes zoster. It's unilateral distribution. Okay? So, varicella zoster is morphologically identical to the herpes simplex virus. Okay, syempre family sila. Okay? Ng alpha. Kaya identical sila. It has no animal reservoir. That's why animal does not suffer from varicella. So the virus propagates in culture of human embryonic tissue and produce typical intranuclear, okay, inclusion bodies. Okay? So this is the pathogenesis, parang herpes simplex then. So the virus inhaled infect the mucosal cells in the nose and throat. Okay? So after which they replicate here, okay, and infect the nearby lymph nodes. From the lymph nodes, it enters to the bloodstream. So that is your primary viremia. From the primary viremia, it infects the liver and spleen. Sometimes lalaki yung liver, lalaki yung spleen. Okay? And from the spleen and liver, it travels to the bloodstream. So that's secondary viremia. From the secondary viremia, okay, it may travel now into the skin lesions, causing blister and cracks. Okay? So immune system eliminates the infection except for latent infections. Okay, so during active infection, our immune system, okay, may eliminate this. But the latent infection hides. Okay, it hides in the dorsal root ganglion. So immunity wanes with, so the virus persists, so become latent in the nerve ganglia. And once you become immunosuppressed, they become reactivated, and reactivation leads to herpes zoster. Okay, okay, so histopathologically, again, is identical to your herpes zoster. It's identical to your varicella zoster. So yung pathologic findings sa tissues similar. Kasi yung varicella zoster, ay kasi yung zoster naman, varicella zoster. Yung herpes zoster naman ay galing sa varicella zoster. Reactivation na siya. Kaya yung pathologic findings sa skin is similar. So it's dermatomal. So it follows the distribution of the nerves, and it's usually unilateral, and it's usually painful. So there is an intense pain. So there is a post-herpetic neuralgia. Okay, so our protective immune system is otherwise known as your cell-mediated immunity. So we need our lymphocytes, your T and B lymphocytes, in order to fight against these zoster infections. Cell-mediated immunity. So your varicella, okay, review, incubation period is 10 to 21. From the inhalation, okay, pumasok sa katawan, you may manifest fever 10 to 21 days after, okay, the inhalation. So this is the incubation period. You may experience malaise and fever. So after the fever, okay, what comes next is the rash. Okay, vesicular rushes, okay, sa trunk, face, and limbs. And you also have a rash, okay, sa mouth. Okay, so inside the mouth, and that is what we call the enanthem rash. So buccal mucosa, and here pharyngeal vesicular lesion. So we have exanthem sa labas, enanthem sa loob. Okay, so this is the lesion of your chickenpox. It's a maculopapular, mapula lang, and after sometimes it becomes elevated, and after sometimes magkakatubig, vesicle, and pag gumaling na, it may lead to crust, drying. Okay, you're drying. So you still have the crust, you still have the virus. Still have the virus, you are still infectious. So all of these lesions can be seen simultaneously in patients with varicella zoster, varicella chickenpox. Okay, so commonly your herpes zoster is seen on the trunk. Okay, they become reactivated in the trunk. They may see in the head, neck. Okay, and these are most commonly affected. Okay, so after your herpes zoster, you may develop very, very painful, okay, post-herpetic neuralgia. Okay, commonly dito sa mata, ophthalmic zoster. Okay, and your zoster can lead to also viral pneumonia. So, pwede pumunta sa lungs. So sabi natin yung varicella, if you have varicella, it confers a lifelong immunity. Okay, but not for herpes because they become reactivated. So antibody from the vaccines, okay, so masarap. Okay, so 60 years old and above should be given, okay, with vaccine, especially those who did not have the varicella during childhood. Kasi sabi ko, if 60 years old and above has or suffer from varicella, it becomes complicated. Okay, so mas maganda bata pa lang. So cell-mediated immunity is important for recovery for both varicella zoster and herpes zoster. So this is important immune protection. B lymphocytes and T lymphocytes. So test similar, you have your PCR, okay? So you get the saliva, vesicular fluid scrapping, this one, the base of the vesicle, and you do a chunk smear. Okay, chunk smear, stain the base of the vesicle, and you can see intranuclear inclusion bodies, the CODI type A as well. Okay, so this is the fluorescent, it emits light, immunofluorescence. Okay, so effects of patient communities and population. So just go over with this slide. It's nice to know. Okay, so treatment for herpes zoster. Okay, so your neonates, okay, who are immunocompromised with severe infection, okay, bigyan ka agad ng varicella zoster immunoglobulin. Okay, so patient with herpes zoster, you give your acyclovir. Okay, so this acyclovir will inhibit the replication of the virus. Okay, so can prevent the development of systemic disease, especially among immunocompromised hosts. Okay, kailangan maaga mong maibigay para malimit yung complications ng herpes zoster. So this is the vaccine available in the Philippines. We have the Varivax. We have the Zostavax produced by the MSD. Okay, MSD Pharmaceutical. So this is very effective, 70% effective in adults and 85% effective in children. And this is 95% effective in preventing severe disease. So para din siyang sa Pfizer. Okay, Pfizer and Moderna. 95% effective also in preventing severe disease. So your Zostavax, okay, Varivax is 14 times more potent version of the varicella. This is effective in older adults at reducing frequency of outbreaks of zoster and severity of disease. Okay, so binibigay natin yan sa older 60 years of age with chronic medical conditions. For example, chronic kidney disease siya, 60 years old, pwedeng bigyan ng Zostavax. Okay, so moving on to your Cytomegalovirus. Okay, so this MIGA is the largest genetic content of the human herpes viruses. So they are very specific, okay, cell type specific. So CMV replicate very slowly in cultured cell. Okay, slowly in cultured cell, and they produce a characteristic cytopathic. Okay, so they produce a characteristic cytopathic effect. Okay, so there is human to human transmission. So it can be transmitted from person to person in several different ways, all requiring usually close contact with virus-bearing material. So the incubation period is usually 4 to 8 weeks in normal older children and adults after viral exposure. So the virus causes a systemic infections, otherwise known as your infectious mononucleosis. Okay, and they become isolated. They can be isolated sa lungs, liver, esophagus, monocytes, T and B lymphocytes, and they establish a lifelong latent infection. So virus can be shed off from the pharynx, urine, okay, months to years after primary infection. Wait lang pa. Okay, so this is your cytomegalovirus. Now you see the kidneys. Okay, so kidneys are infected. So once the kidneys, they become seems to be more deleterious, especially in normal person. So salivary glands are also affected here. Okay, so this is the transmission among immunosuppressed hosts. Transmission is to oral, sexual, or transplacental, especially pregnant. So the primary infection, okay, leads to viremia, and it also leads to multi-organ dissemination. So it may be asymptomatic, infectious mononucleosis, and severely symptomatic. So there will be cili conversion. You develop antibodies against the cytomegalovirus, particularly IgG. Okay, and if you develop IgG, there will be viral clearance. Okay, after viral clearance, it become latent. Okay, where do they become latent? Usually in the lymphocytes. Okay, and once you become immunosuppressed, they become again reactivated. So ganun lang naman yun. Okay, so this is a very important feature in the jowets, you have the Cnb infection sources, usually the breast milk. Okay, so this can be passed through your breastfeeding mother sa kanyang infant, such as neonate, toddler, okay, so urine and saliva, sex through semen and cervical secretions. Okay, so pwede makuha ng bata, okay, through cervical secretions during delivery. Okay, so there is placental infection, so it can be transmitted through placental, okay, circulation. So the primary, so 20 to 40%, okay, fetal transmission. So of this, they become symptomatic at least 5 to 10%. Okay, so the child may suffer from intrauterine growth restriction, retinitis, microcephaly, jaundice, hepatosplenomegaly. Okay, and permanent damage is usually 50 to 80% sa mataas, leading to mental retardation and blindness, and death mataas din, 20%. While your asymptomatic is usually 90 to 95%, and the late sequelae, deaf learning deficiency, is 7 to 25%. So the primary infection is usually asymptomatic. So 20 to 50% are usually heterophil negative. Okay, and subclinical hepatitis is common. So immunity to cytomegalovirus, okay, is also your humoral, the presence of humoral immunity or B lymphocytes. So the presence in breast milk does not prevent transmission of infection to breastfeeding infant. So it does not prevent. So pwede pa niyang makuha sa breast, sa milk. Maternal antibody protects more against the development of serious disease in infants and viral transmission. So test is also PCR pa rin. Okay, mas mabilis gawin. Okay? So you detect the viral replicating virus. So you can also do PCR sa blood and urine. Okay? So your can be isolated through your human fibroblasts. Okay, so throat and swabbing, and you can see cytomegalic inclusion bodies. Okay, so this is the cytomegalo. See the large virus. Mega means large. Okay, so this will be cytologic changes. Okay, viral serology usually increases. Okay, is your IgM. Okay, after some time, if IgM goes down, okay, your IgG begins to rise. Okay, and secondary exposure, okay, usually what increases is your IgG during secondary exposure. Okay, so this is the epidemiology of your cytomegalovirus. So go over with this. Okay, so treatment are your ganciclovir. Okay, so just go over with this one. Okay, we have your foscarnet. Okay, particularly for cytomegalovirus retinitis. You have also screening for transplacental donors and recipient of CNB antibody may prevent some transmission of primary CNB. So if you can donate, if you are a donor, okay, to a chronic kidney patients or kidney donor, okay, the donor should also be screened for infection of CNB. Okay, pwedeng magkaroon ka ng CNB but you do not manifest because you have an intact immune system. Next, the last one is your Epstein-Barr virus. So your Epstein-Barr virus DNA contains 172. It has a guanosine and cytosine content. 59% encodes about 100 genes. So there are two major strains of BB, type A and type B. So this is an envelope again virus with a linear double-stranded DNA, and it has a capsule. So the major target of your Epstein-Barr virus is the B lymphocytes. See? Doon siya sa B lymphocyte papasok. And when it enters into the B lymphocyte, they also replicate inside the B lymphocyte. So where they enter, also they replicate here inside the salivary gland as well. So once they enter the salivary gland, they penetrate the B lymphocytes. Okay? So B lymphocytes are infected with EBV. So continuous cell lines can be established indicating cells that have been immortalized by the virus. So nandito na yung virus sa B lymphocytes, na immortalized na yung B. So EBV initiates infection of the B cells. By binding to the viral receptors of the B cells, we have the C3D. This is where they bind in the B lymphocytes. So once they bind, they enters into the B lymphocytes and they become latent in the B lymphocytes, undergoing a period of latent state in the lymphocytes without undergoing a viral replication. Latent. So they are still in the B lymphocytes. They do not replicate, but stay in the B lymphocytes. So the hallmark of latency, you see, persistence, restricted virus expression, and potential for reactivation and lytic replication. So once they become reactivated, they get out of the B lymphocytes and they enter again. They go back to the salivary glands to infect another person. If you have a kissing, okay, that's how it's called kissing disease. So this is the primary infection. Okay, the primary infection, we have the Epstein-Barr virus. This is commonly transmitted via saliva. Okay, after which it enters into the oropharynx. From the oropharynx, it destroys the epithelial tissue. Wait lang po. Hello po. Hello po. Yes, ma'am. Yes, ma'am. Apa na talking ka, ma'am? Thank you po. Thank you po. Okay. So once they penetrate, they enters into the B lymphocytes. Here, the lymphoid tissue and peripheral lab. They are inside the B lymphocytes. Now, this patient will develop an Epstein-Barr nuclear antibodies. This is otherwise known as heterophil antibodies. So viral replication occurs in the epithelial cells, is one, epithelial cells of the pharyngeal and salivary glands. And many people shed the low level of virus for weeks to months after infection. So here, the infected B lymphocytes, this one. Okay, so viral shedding goes into the B lymphocyte. Here, the infected B lymphocytes, here one, spread the infection to the oropharynx throughout the body. So when you kiss this individual, infected individual, it may transmit the virus via the salivary secretions. So I want you to go over with this video on the YouTube. This is a very nice explanation of your Epstein-Barr virus, your infectious mononucleosis. This is a very good explanation. It will tell you the antibody production and it will tell you the pathophysiology of your Epstein-Barr virus. So go over with this link, okay? You just type an Epstein-Barr virus pathophysiology. Okay, so again, this is the antibodies that usually increase. We have the viral capsid antigen IgM, okay, and we have the IgG. Usually, IgM usually the first one to increase, followed by your IgG. Okay, so this is the clinical presentation. Okay, it can be acute, chronic. Okay, in children under 5 years of age, the disease is very mild. So this is also seen in adolescent and young adults. So incubation period is 10 to 15 disease. So these are the symptoms. We have fever, fatigue, exudative tonsillitis. Okay, so features of generalized viral infection to the EBV, so-called anginos from infection of mononucleosis. So since they replicate in the salivary gland, they infect the lymphoid tissues near the salivary gland. Okay, there will be cervical lymph nodes enlargement. Okay, spleen, they go into the spleen, there will be splenomegaly. They go into the liver, there will be hepatomegaly, and sometimes they experience, okay, hepatitis. And you see at the angle of the mouth, parang meron siyang buhok-buhok na kulay puti, and that is what we call your hairy leukoplakia. Hairy leukoplakia. So this is associated with Burkitt's lymphoma, and it can lead also to nasopharyngeal carcinoma. Okay, so these are the viral antigen. EBV are divided into two classes based on the phase of the viral life cycle in which they are expressed. So latent phase are synthesized by latently infected cells. Early antigens are non-structural proteins whose synthesis is not dependent on the DNA. So the late antigens are the structure components of the viral capsid and viral envelopes. Parang kanina yung replication niya, yung late antigen, eh doon nagkakaroon na ng capsid. So the viral capsid antigen, VCA, okay, so the antibodies produced initially are your IgM, and this will be followed by IgG. So this is detected early phase and disappear in 2 to 4 months. So the early antigen, okay, IgG type is highly indicative of, you see, the IgG type is highly indicative of acute infection. You see, during the acute infection, tumataas na rin kasi yung IgG. Okay, this one, the acute phase, you can see the IgG is also increasing. Also, the IgM is also increasing. Okay. Okay, it is absent in 10 to 20% of patients, and it disappears in about 3 months, and it's present in the nucleus and cytoplasm. So the early antigen, okay, is usually not found in young patients. So it appears transiently in recovery stage and it's also present in the cytoplasm. So these are the titers of your EBV nuclear antigen is found in the nucleus of all infected cells. You see, if the titer, antibody titer is less than 1:10, it's negative. 1:10 to 1:3 indicate infection. And more than 1:320 is indicate acute infection. So antibody titer is also very important in order to determine if you have an acute infection. Okay, so your IgM antibodies are seen in infectious mononucleosis, Burkitt's lymphoma, chronic fatigue, and chronic hepatitis. Okay, so these are the signs and symptoms of your infectious mononucleosis. You see here the hairy leukoplakia. Okay, so the whitish plaque lesions, para siyang buhok ni Medusa. Hairy leukoplakia. This is typical of your Epstein-Barr virus. This one is one you can see here. Yeah. So meron akong patient sa Kansas City, an HIV patient with Epstein-Barr virus, and you see hairy leukoplakia at the side of the tongue. Okay, so that finishes our lesson. So again, to summarize, we have the family of herpes virus. So this is a large family. So your herpes viruses are large. It has many proteins inside the inside the cell, and it is divided into three. We have the alpha. So the alpha 1 is otherwise known as your Hsv1. The alpha 2 is otherwise known as your Hsv2, your genital. Your 1 is your fever blister. Your 3 is your varicella zoster. So your varicella zoster becomes reactivated. It may lead to herpes zoster. Your 1 and 2 become recurrent reactivation during the immunosuppression state. So we have the Cytomegalovirus. This is very important, especially if pregnant mothers are infected, because this may lead to mental retardation. So we have also the human herpes virus 6 and the human herpes virus 7. So we have discussed here the Rosola infantum or the Hsv1. So you see rashes among infant. Okay, we have also discussed the Epstein-Barr virus. So the Epstein-Barr virus usually infects the B lymphocyte. You see here, they become latent in the lymphoid tissue, particularly on the B lymphocyte. We have discussed HHV8, Kaposi sarcoma. So these are common among HHV patients. We have also discussed the treatment, okay, treatment of these herpes viruses. Okay, so any more question? Kasi magbablog sa vegan ngayon, 9 a.m. Okay, so any more question? May iba pa nag-aabot. So any questions? Let's see. So if you have some clarifications. Do you want to clarify things? Next week we will announce we have a quiz, 50-item quiz, subject ni topics ni Dr. Velasco at saka topics ko. So there will be 50 items for my pathogenesis of viral infection, my first topic and this one. So we will have a 50-item quiz, sabay-sabay kayo mag-e-exam. So we will get the schedule, sabay-sabay mag-e-exam, sabay-sabay mag-open yung exam. So ABA from section A to H, okay, simultaneous. This will be next week. So we will announce prior to Saturday para at this point in time makapag-prepare na kayo. So it's a 50-item quiz. So all simultaneous na quiz, para sabay-sabay. Walang link na mangyayari. Mamibigyan. Okay? So,
Doc, ilang minutes po namin na-answeran, Doc?
We'll post it. Depende pa. Tingnan natin doon sa kay Dr. Velasco. If how many minutes usually ang 50-item quiz. Topics ni Dr. and topics ko.
Doc, question po, Doc.
Yes.
Doc, regarding dun sa vaccine about sa sa varicella.
Yes.
Nagkakaroon po ba ng ng mga crash after vaccination?
No.